Actions speak louder than words, and sometimes inactions, they speak louder than the both of them. Hi, I'm Tracy Yankin. I am the CEO of Mosaic Life, which is an AI-driven wellness app. I'm also a health informaticist. In healthcare right now, we are driving as fast as we can to keep up with the next regulation or the next piece of technology that we've got to adopt. We're speeding down the road and it feels just like we're on a wild ride right now. But we have to keep in mind that even though we're on this wild ride, we've got to make sure that we don't leave patients sitting on the side of the road wondering what happened. So today I want to talk to you about how we can use AI to help with patient engagement. We can bring AI into the patient's world to help us solve some of the problems that cause patients not to take action and to participate in their treatment plans. We've known that patient engagement is very important. Patient engagement, if you don't know what that is, it refers to the active involvement of patients in their healthcare journey. It was defined by Hibbert and Green back in the early days of patient engagement around 2013. Now, did you hear what I said? I said it was a healthcare journey. It's not a healthcare solution. It's not a healthcare destination. I said it was a journey because it is a journey for us to take the best care of ourselves that we can. Hibbert and Green, they also talk about the characteristics of what an engaged patient looks like. Engaged patients, they're involved in creating their care plans. They understand what they're being told. They are part of the decision making that happens, and they practice self-management activities. For example, they understand who to call and when to call to make a decision whether to go to the ER or to call their PCP. We, the collective we, all are patients and we want to be successful. The truth is, you're a patient, I'm a patient, our parents are patients, our children are patients. Basically, if you're a human, you have been or you will be a patient somewhere. And as patients, we really do want to be involved in helping to maintain our health. The thing is, we want to make sure that we are getting easy wins. So when we have small wins, those wins turn into habits, and those habits turn into adopted behaviors. We want our physicians to be happy with the work that we're doing, and we want to be happy with the results of our efforts. It's a great situation when both the patient and the provider get to experience healthier outcomes. I travel across the country every 8 weeks because we have my in-laws on one side of the country, my parents on the other side of the country, and we go back and forth. Our parents range in age from 85 to 79, and so we help to manage their health needs in addition to our own health needs. Interesting enough, yay parents. Our parents agreed to help me this week with this week's live. So with their permission, I took some of their after visit summaries. We downloaded some information out of their patient portals. Some of them have only been logged into this one time. We transcribed some of their recollections of appointments. And my husband and I, we also transcribed some of our own recollections of some of the appointments that we've attended with them. So we took all this information, we put it in AI, and we asked it to do some analysis. It came up with a person by the name of Pat. Now, Pat's going to be the representation and the amalgamation of all the subject data that we gathered. This is what it came up with, and I thought this was very cool. This is the narrative. A few years ago, Pat was really struggling to manage their chronic condition. And despite regular visits to the doctor, they often left feeling confused and unsure about the treatment plan. Sometimes they did not even understand the medical jargon that was spoken, and they just didn't feel comfortable asking questions. When Pat gets home, it's really hard to stick to any kind of treatment plan because they're unsure what to do, and they also had follow-up questions. Now, that can be a real challenge to follow through and to follow simple directions like, we're going to change your meds, fill this new script, and then start when you get home. This isn't just about the services being for older people. I know young adults who deal with major medical issues like having to have colostomy bags. I know parents who've got disabled children. It's really hard, and they've all expressed these same feelings. When you're trying to digest a whole conversation, You don't have time sometimes to process or to ask questions right away. And then when you get home, you're not really sure of what you're supposed to do. Do you take the new pill now? Do you wait until it comes in the mail? Do you take the same dosage until that happens? Do you break the pill in half to make sure that you're getting the new dosage? There's always a lot of questions when you get back home. There was a study that was done and it showed that when patients perceived their communication was great with their provider, 70% of those patients followed the plans that they came up with their provider. However, when the patients felt that they had a poor communication experience with their providers, only 50% attempted to do it. 71% of patients said that they don't follow through on their physician's care plan. And why did they state that that happened? Well, they said that they disagreed with something that was said or they just didn't understand. I know that we only book 20-minute slots, sometimes even 15 minutes. And by the time people get into the office, you get into a room, there's documentation time. The face-to-face time with your provider really shrinks down to about 7 minutes. And it's hard to communicate a lot of information in 7 minutes. It's hard to ask questions, and it's hard to have a meaningful dialogue in such a short period of time. Part of the challenge can also be cultural and social. So, in some cultures, storytelling is the preferred method of speaking. Visits generally aren't long enough to have time for storytelling. I applaud those providers who take the time to do it or at least try, because I know the pressures, both administratively, that are out there and that are coming from the patients when you're late to get into a room. The one thing that I do know though is that communication, when it breaks down and it results in gaps in communication, outcomes worsen. And at the end of the day, if you're a hospital organization or any sort of healthcare organization, it's going to show up in your bottom line because it increases the cost of care. So as I mentioned before, I travel quite a bit. So I get an opportunity to talk to a lot of people, and especially my Uber drivers on my way home from the airport. It's interesting because when people say, "Hey, what do you do?" I tell them what I do. And 9 times out of 10, the first thing they say to me is, "Well, then how come A, B, C, and D happens every time I go to the doctor? This didn't go right. That didn't go right." So I get an opportunity to collect a lot of anecdotal data, and I get to spend a lot of time thinking about it. So let's go back to Pat. One of the things that I think about is what could we do to make this whole situation, having patients have a better experience, better with AI. And the first thing I think about is having an AI driven virtual assistant. So we use these in marketing already. So how come we can't use the same functionality in healthcare too? The automation pieces. You know, your assistant could actually answer questions in real time depending on what kind of assistant it is. So depending what kind of AI you build, you can have it do many different things. These AI assistants could send you a phone call to see how you're doing. They can monitor what's going on, your diet every day. They can send you a text message so that you can take your medication on time. And the interesting part is what I just mentioned, that whole voice call system as well as a text message. We already have these technologies integrated into our workflows. They're already there. We've already spent the money to put them in. The best part is, I think, about having AI is that it really can give me guidance based on my own personal medical history and my lifestyle. So, lifestyle, that can also mean your cultural norms. We're here in America, but we are all American by birth, but culturally, a lot of us have other nationalities that we have all mixed up within us, and we express those in the way that we eat, the way that we interact with one another. So I really think about culture when it comes to the patient. I know a nutritionist and she runs this amazing community for Asian members and it teaches them how to address colon cancer. So if you didn't know, the amount of colon cancer right now in the Asian community is skyrocketing. So what she does is she works with these members and she helps them talk about how they eat and how it fits into their cultural practices. Food can be a large part of a person's identity. So, how do I use AI for my health? Well, when my triglycerides came back elevated, I took information from my PHR and I took 4 years worth of labs. I threw it into the AI. I said, look at this, look at the trending. These are some of the circumstances around this time. I like fish. I like feta cheese. I like arugula. I don't eat mayo. I don't like leftovers. Give me a menu to lower my triglycerides. I got this beautiful Mediterranean menu. And when I was done with the Mediterranean menu, I asked for my shopping list. When I got the shopping list, I was like, oh gosh, I'm going to spend 2 hours running back and forth inside of the grocery store. So I asked the AI to organize my list by aisles. I told it what grocery store I shopped in, the location that it was in, and within seconds, I got a shopping list that made my trip to the store more orderly and managed. Everything was in different sections and things were grouped by aisles inside of the grocery store. I know it sounds like a silly analogy, but it's very important. And why is it important? It's removing a barrier to my shopping for healthier food because I don't want to be in the store for 2 hours. And you might think that that's just a real little thing, but let me tell you, I think you need to rethink the situation. This is a win. It's removing a barrier for me at the point of service. And this is how we can use assistance and have AI help us. Start thinking agile. First, you remove one barrier, then another barrier, then another barrier. It's like dominoes falling down. If we can overcome these small little barriers and get wins that I talked about earlier, our health outcomes become better because then we start to eat healthier. And then we can use AI once we've conquered and built that habit to start to work on increasing exercise. You know, again, I'm not going to discount these examples as not important because it's about what the patient needs. That's what's important. And people become engaged when they feel like they're making progress. And then when they make progress, now they got skin in the game. Thank you for joining me. Next week, we're going to talk about what are some of the steps that you need to take to build out one of these helpful little assistants to automate different nudges for your patients. Thank you for joining me, and I'll catch you here again next week on the flip side.